With AI, I feel like Dr. A, why I left hospital medicine to become a general practitioner. 7 reasons to choose GP. Let's see what he has to say.
After working in emergency medicine and surgery for 2 years in London, I decided both were not for me and I joined general practice in Cambridge and I love it. There are 7 big reasons as to why I decided a job in a hospital is not for me and that the GP's office is where I want to be. So let's discuss those in this video. You know, there are these medical students who know exactly what they want to do once they graduate. You hear people saying, oh, you know, like I always knew that I want to be a brain surgeon and nothing else, or like I wanted to be an oncologist or a cardiologist and nothing else. I was not one of those people.
Most people are not one of those people. So if you look at the data from the AAMC in the US, more than 50%, the majority of medical students, when they start medical school to when they graduate, they change their intended specialty. There are certain specialties that have a much higher rate of like aspiration than others. Neurosurgery is very sexy, orthopedic surgery is very sexy. But I thought I was gonna be a pediatric gastroenterologist and I ended up doing plastic surgery.
During medical school, like as a medical student, I sort of liked the medical subjects more because it felt like puzzle solving and a bit of like detective work. But then during my internship, when I actually got to treat patients with my own hands, I actually started liking surgical subjects as well. And yes, that includes OBG as well.
Surgery is the best. Those in America who aren't familiar with the UK system, they do 6 years of med school right after high school. And then they do 2 years as a junior doctor, which is essentially MS4, 4th year of med school, plus intern year. And then they start their specialization, their residency, after their junior year. So he's doing all these rotations as a junior doctor and as a med student, and he's loving them all. And I can kind of relate. I liked most of my rotations. There were a few that stuck out as like, this is definitely not me. But if you go in with the right attitude, you'll find a lot of different things to enjoy about each specialty. I liked IM in certain ways, especially hospital medicine. Clinic, I guess it was a little bit slow for me, but there were days in clinic that were even really fun. OB-GYN, I've talked about before on the channel, definitely a lot of sexism, a lot of hate towards men, which not my jam, obviously, at least at the place I was rotating at. But most other things I did actually really enjoy.
So I was sort of like really confused as to what specialty I want to specialize in. And I also hated the shift work. One day, like your shift would start in the morning and the next day it would be like an afternoon shift and then an evening shift.
This is very common when you're in your training years in residency in the US for specialties that have shift work. So emergency medicine, when I was on my emergency medicine rotation in residency, yeah, like you get the crappiest shifts, especially because I'm not even in emergency medicine. I'm from plastics that's then rotating 1 month on EM. So like, yeah, give him the crappiest shifts and then give the actual EM people better shifts. And then within EM, it's by seniority. So the attendings have the best shifts and then the senior residents have better shifts and the junior residents have the worst shifts. And then me down here, yeah, there was days where it was just all over the place. That's not the norm forever once you finish your training.
I couldn't sort of like plan my cooking and things like that. I sort of hated that bit and I sort of realized that, you know, that's not the lifestyle that I want to have.
But the good thing about that lifestyle is that you clock in, you clock out, and you're done. You don't take work home with you. You don't have to stay late. And a lot of other specialties, especially surgery as an example, you're staying in the hospital a lot longer than what the shift duration is in something like EM.
And then I got this colorectal surgery offer. But then, you know, after I started working, kind of realized it was not really that exciting, at least for me, because a lot of these bowel surgeries takes just so long. And as a junior, you don't get to do a lot of things. So I found that a bit boring.
By the way, a lot of juniors, you're not going to be able to do much, especially depends on where you are. But as we've talked about in previous videos like this one up here, if you make yourself a really competent med student, a really competent intern, a really competent PGY2, they will let you do way more. I know at my OA rotation at Stanford, the program director in plastic surgery said, Kevin, I like the way you think, because he was pimping me on like some random things. And he, they want to see if you can talk about complex subjects while you're using your hands. And then he also said that, you're doing well, you're operating at the level of a PGY2 or PGY3. I was a 4th year med student at the time. So I was able to do a lot as a junior, as a med student in residency. And that's not to toot my own horn, it's because I followed the protocols and the strategies right here, put in a lot of time, and then that's gonna pay dividends if you practice. So don't think that you're doomed to always just retracting as a med student.
During this time, I also sort of came to a realization that hospital specialty training in the UK is not that great. I mean, it's actually quite terrible if you think about it. First of all, the training is long. It's like 8 to 10 years. And during that, you'll be moved from one place to another every 6 months or, every year or so. So you can't really settle down in one place. And the training itself is rubbish.
My cousin in India says rubbish too.
But there's absolutely no bedside teaching. If you're in surgery or something, they do teach in theaters, of course, like it's a training job, but there's no bedside teaching. Like the consultant doesn't ask you questions.
For those in the US, consultant is the same as attending in the UK system.
Unlike, in India and also in the US, where like the consultant goes on ward rounds and he's quizzing all the juniors, that sort of forces you to learn, that sort of makes you learn. Like even when it's not you that someone is asking question to, you're listening to your colleagues talking and stuff. So you're learning things by just absorbing it passively.
That's true, and it's called pimping is the term that we use in the US. Strange use of term, but it's high pressure, and they're gonna ask someone a question, whether it's you or the intern who's above you or the resident who's above them. And sometimes they'll even start at the lowest level and work up to see who can get the right answer. But it's high stakes, it's high pressure, but it's active learning and it works really well.
And the worst bit is that even after you finish training, a consultant job is not guaranteed. Like I know a lot of people who have finished their training and still working as post-CCT fellows and have not got a consultant job. And that to me is a terrible deal.
Job security is something that you do begin thinking about when you're deciding on a specialty. And you see that with the data. You see the competitiveness of certain specialties change over time based on the job prospects when you finish that training. Look at EM recently in the US. Look at rad-onc as well.
I sort of liked all specialties and couldn't really choose one specific specialty. And what I realized is that with general practice, I can literally practice all of these specialties on the same day. I don't have to choose. I can sort of practice all of them.
If you do find yourself to be the person who loves everything you rotate on, and you don't really strongly gravitate toward one thing, then yeah, general practice gives you a little bit of everything. You're not going as deep into anything, right? But you're getting a flavor and you're getting some of the things that you appreciate about, oh, hey, I want to work on musculoskeletal. Cool, I'm doing some sports injury thing right now. And if you're in family medicine, you get a touch of pediatrics and OB-GYN and all those things.
All these common coughs and colds are usually seen by the pharmacist, and I almost never see such cases. The things that I see are more like exacerbation of asthma, complex ear infections, complex mental health diseases, which is so very common in the UK, unfortunately.
I'm surprised that those patients don't generally see a psychiatrist. Maybe they get referred out if it's severe enough, similar to how things are sometimes in the US. But the other thing here is that he's explaining the bread and butter. So when you choose a specialty, you want to know the bread and butter, not the really cool zebra sexy thing that you're going to see once every year or two. What's the thing you're going to see most days of the week? Because if you're miserable most days of the week dealing with what a general practitioner is going to be doing most days of the week, then that one time every 2 years is not going to cut it.
I also love the fact that I am the doctor for everything. Like here in the UK, you can't directly go and meet a specialist. You have to first see your GP for absolutely everything. I get to make my diagnosis, and it's just so interesting. Like someone comes with like some very rare, autoimmune disease, although I don't probably end up making the diagnosis, like I can recognize the fact that this is not something that we usually see.
It's not lupus.
The joke is because on your board exams, when in doubt, it's lupus, right? It's like it's always lupus, so it's not lupus. Hilarious.
So yeah, I found that like really fascinating and really, really deeply satisfying.
Awesome. He clearly made the right choice for him for specialty, right? So for those who are deciding on a specialty, get a feel for what do people like and dislike about various specialties. We have a whole series called So You Want to Be on the Medical Insiders channel. We dive into each and every specialty. We also have Why I Didn't on this channel, where I tell you why I did not pursue certain specialties. And it's a very personal decision. There's no right or wrong. He clearly is enjoying a lot of the things that for someone like me, that's not why I like primary care. The reason I like primary care, well, it was more that I liked hospital medicine of internal medicine because of like the solving a puzzle feeling, the detective work. That was exciting to me. That was very intellectually challenging and I enjoyed that. But then surgery was a different side that I enjoyed. Pediatrics, well, I kind of enjoyed it, except for when I had difficult parents. Then I was like, well, that's gonna be a very frequent thing. Probably not a good fit for me. OB-GYN I talked about. Neurology was also kind of like that puzzle. And I just love I was a neuroscience major in college. So love the central nervous system and localizing the lesion. A lot of people hated that stuff. I just loved it. So these initial interests are enough to tell you where to start looking more, but it's not enough to make a definitive answer until you really get much more exposure and you know the ins and outs of that specialty, including, again, the bread and butter.
I like having a routine. I like getting up at the same time every day, and then I like going to work on the same time, doing similar sort of work, coming back home at the same time. And this is very difficult to do working in the hospital when you have so many night shifts, so many long shifts, evening shifts, and things like that. Whereas in GP land, work is always 9 to 5 or 9 to 6. You always get your weekends off, and it's the same thing week after week. So I essentially end up working per se only 3.5 days a week.
Lifestyle is also something very important when choosing a specialty, and primary care, you're gonna have a more regular schedule, more regular routine, but there are some other specialties that allow for that as well. It's not just primary care. And that brings us to today's sponsor, Levels. Now, Levels has this slick app and it interfaces with a continuous glucose monitor that you wear on your arm. I've been wearing one almost daily now since 2019, which is when I actually signed up for Levels with my own hard-earned cash. I found it so valuable that I wanted to work with them. There's this common misconception that unless you're diabetic, there's no utility to wearing or using a continuous glucose monitor, CGM. That's not the case. By using Levels consistently, I've actually improved my sleep quality by optimizing my glucose near bedtime. I've had the insights to tailor my diet based on what actually works for me and what doesn't, because this is personalized. This is not just some generic glycemic index. And it holds me accountable with exercise and nutrition choices. And speaking of accountability, they've added this awesome new feature called Habit Loops. So you can actually choose 3 habits from fitness habits, nutrition habits, and wellness habits. I chose 3 that I struggle with. So I know for me that total protein intake is not gonna be a limitation, but things like making sure I work out at least 90 minutes per day, have at least 3 days per week where I have no spikes at all, and also sleeping more than 7.5 hours per night, that's gonna nudge me in the right direction, and the Levels app holds me accountable. You can choose different habits and also adjust your target for each. As an example here, for sleep duration, I can increase that to 8 hours if I want. And they're soon gonna be adding water intake and mindfulness time as well. I really believe that what Levels is doing is changing lives, so much so I even put my mom on their product. Try Levels today and get 2 months free on your annual subscription using my link below. And I hope you enjoy it.
Because GPs are generalists, there are a lot of other things you can do after you're a GP. You can specialize in occupational health, you can do sports medicine.
The US system is a little bit different. So if you want to see, so for primary care, the main primary care specialties here in the US, most people think of family medicine as well as internal medicine. We have So You Want to Be episodes on each, right up here and below in the description. And we go over the fellowship options. So these are essentially additional training years you do after residency, fellowships, 1 year, 2 years, 3 years, that allow you to subspecialize further. There, you can't go into dermatology from primary care. And yes, because someone will say there are other primary care specialties as well, including OB-GYN and others.
You can do a lot of things as long as you're trained for that. So there are some people who run outpatient cardiology clinics, and they're GPs who have sort of trained in cardiology for a couple of years after being GPs.
In the US, you would do internal medicine for 3 years, cardiology fellowship for 3 years, that's 6 years total after medical school, and then you're a board certified, assuming you pass the boards, board certified cardiologist.
That flexibility, I sort of like it. Like I can just do, in a sense, anything I want to. That's quite interesting and important for me.
We're really focusing a lot on specialty choice in this video, obviously. What I'll say is, if you are unsure what to do at the end of med school, the default thing to do is generally internal medicine, because from internal medicine, you can do a lot of different fellowships. And I have some friends who were like that, where they were actually, I remember Dr. Amit that we had a conversation with on this channel. He released a great book, check that out. I remember him telling me end of med school, is like, Kevin, I'm almost envious of you that you are so in love with plastic surgery, that's so clear to you what you want to do with your life. I know, ironic, I dropped out, he's practicing. Because he was like, I don't feel that way. And I'm like, I feel like I just need to do the default. Everything's kind of okay. Nothing really stands out as being better than the rest. I don't like love anything, but yeah, I guess I'm doing internal medicine. And now over time, he's grown to love it. And he talks about that more in his book. But internal medicine really is the default specialty in the US, and it's the most common residency position. There's the most number of seats for IM versus any other specialty, and a lot of fellowship options afterwards. Cardiology, gastroenterology, oncology, hospitalist, the list goes on.
There's a very big shortage of GPs and primary physicians all over the world. So essentially for the next 20 to 30 years, my job will be in very great demand. And the job is such that like technologies like AI won't be able to like sort of take over the job.
With AI, I feel like certain specialties are at higher risk. Radiology probably at higher risk as an example. Something like primary care, GP, I would say maybe not as high risk, but like moderate risk. The lowest risk specialties I would say would be things that are highly procedural, right? Something like interventional cardiology or various types of surgery. But still, a lot of these things are a bit of ways.
Because your job is in demand everywhere, you will find a job essentially wherever you want to. If I want to go to Canada, I can go there. If I want to go to Australia, I can go there. If I want to go to, UAE, I can go there.
Note he didn't say the US, because the US is unlike all these other countries. They say if you want to come here and practice here, you got to do training here. and he probably doesn't want to do residency all over again.
So with any career decision, the potential amount of money you could make, with that job will come into the picture at some point.
In most specialties, you're living an upper middle class lifestyle, no question, at least in the US.
But I think the potential is the best with GP because essentially, look, the training is short. In 3 years, you start on a basic consultant salary, which is about 90,000. You can go up to 100,000.
A lot lower than what we have here.
Become a GP partner, like a partner in a practice. So essentially, you're like a business owner. You'd be making 150 to 200,000 pounds if it's in a good practice. Or you could just set up a private company and do locum shifts. You could make anywhere from 120 to 160,000 pounds. And if you have your own company, like you won't be paying much tax because you're taxed as a company, not as an individual. So you can, potentially save a lot of money.
Similar to the UK, in the US, there are different practice settings based on what specialty you do. So for primary care, the average compensation most recently for a family medicine doctor or pediatrics doctor or internal medicine doctor is around 250K. Pediatrics is on the lower end, around 220-ish average, and internal medicine is gonna be a little bit higher. But again, it's gonna vary a lot based on your practice setting, the location you actually choose, Midwest versus a large coastal city, and on and on.
But more than this, there's a specific type of flexibility that comes in when you're a GP. So as a locum doctor, I could just work 6, 8, even 10 months a year and take the rest of the year off and just travel and do whatever I want.
I think in the US, you could get that kind of flexibility. So if you just want to work for X number of months during the year and you don't want to own your patients for follow-up, anesthesiology, radiology, emergency medicine, there are a lot of specialties you can do. But most people aren't in a position where they can do that because in the US, got student loans and cost of living is really high. And to say no to that income, you're really going to compromise your lifestyle.
I love the concept of flow state, but basically flow is a state of mind where you're so immersed in whatever you're doing that you don't feel tired, that you actually, sort of enjoy it and go into that, what people call the zone where you just feel very relaxed and you're getting the job done. Now, working in a hospital, it's full of distractions. There'll always be colleagues around who want to come and talk to you. There'll always be the nurse who wants you to do something. Whereas in GP, I get an office for myself. No one is coming to disturb you. The patients come to you, to your space.
It's great that Ajay is able to find flow state in clinic. I personally was never able to, not even slightly. I find it very chaotic. There's always a rush to get to the next patient. As a trainee, you're presenting your patients to your higher ups, formulating plans, bam, 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 onto the next. And the time that I very frequently experienced a flow state was actually during operating, not retracting, but when you're actually the one who's doing suturing or using the bovie or whatever. That's when I found that really elusive, that enjoyable flow state. That and taking my car to the racetrack, those are the two things where you're really focused, no distractions, and you're much more likely, from my experience, to enter a flow state.
There's a bit of admin work. You have to read and write a lot of letters to hospital colleagues and hospital specialists. There are social security, social care issues that you have to deal.
And that's one of the things that a lot of us hate about primary care, because you want to do the doctoring things, not so much the social work things. A lot of times that falls on you.
But that's something that I personally like, so it's not a big issue for me, but for some people,
he's a rare breed.
Even though it's, as a trainee, it's just 3.5 days a week, it's not exactly that because you have to do a lot of studying.
That actually seems not too bad. So things in the UK are a lot easier on trainees. In the US, you're working 80 hours a week in the hospital and then having to go home and study, and then also having to go home prepare presentations at your grand rounds and for the next day's cases. But it's a trade-off. There's things that are better there, there's things that are better here. You get paid a lot more in the US, of course. That's why a lot of people, not only from the UK, but from other countries as well, want to come to the US because the US has some of the highest paid physicians in the world. And you work so hard for so many years, you want to get paid well. Ajay, first time coming across one of your videos. Really like your content, great stuff. Happy for you and my friends. Let me know your thoughts with a comment down below. Much love. I'll see you all in that next one.